Manchester and LA resident Liz Brown Swanson contracted COVID-19 in early March, early in the pandemic. We spoke to her a couple of weeks ago about the course of her illness, and we want to check in to see how she's feeling today. Hi, Liz.
How are you both? Thanks for having me with you.
We're,
And I miss being on Cape Ann, but sheltering in place here in California isn't so bad either. But thanks for checking in, and I'm feeling much better.
so, yeah, when we spoke, you said you could still feel a little bit of the COVID around, right?
Yeah, the thing about the virus for me, it lingered, and I think when we talked, I had been tested on April 1st, which was several weeks after my known exposure and having all the symptoms that you were hearing all about. I'm including the loss of smell and taste and the fever and all that. But what concerned me was the fact that I even like up to a week ago, I lost smell and taste again for half a day. I was flipped out. So that's new news for you since I saw you or talked with you because again, it was a good 4 weeks since I'd been sick with fever. Like that had been gone. So I talked to some other folks that were exposed at the same time was I was, and they also said smell and taste was coming in and out. So thankfully I got tested I went at least and got checked for antibodies. So, and to see also, is the virus still present? So over the weekend, and so I went to a local medical group here that's been offering the only drive-through test site where I'm residing. And they have done 200 clinical trials. They're very well established. So, you got to be careful, like what kind of test you're taking right now to know how accurate it is. So anyway, I did test positive for the antibodies and negative for a current infection. So that gave me some relief to know that it really, truly, at least according to that test, I no longer am testing positive for COVID-19, but I did test positive for antibodies.
Now, that should be no surprise, right? That you tested positive for antibodies. Is that right?
Well, you would think that, no, you would think assumed I had the virus. I'm probably going to have had the antibodies. But I asked the nurse practitioner that was doing these tests, and it was amazing, these frontline workers, because they were out there all day in the hot sun on this rooftop testing local folks here. And I asked her in terms of what are they finding? She is finding people that have had infections, had all the symptoms, are testing negative for antibodies.
That's
So
amazing.
and also my husband, to add him, we talked about him. So he was exposed like I was, asymptomatic, never thankfully had any symptoms. He did the same test with me, the drive-through test, and he tested negative for antibodies. So he was asymptomatic, but he had tested positive for the virus.
Right.
So I asked the nurse, are you finding a trend with asymptomatic folks that are also testing negative for antibodies? And she said, no. The thing is, she said, this is a 4-month-old virus. It's like, think of a new baby, 4 months. There's so much we don't know.
Right.
And
Right.
what the results are actually showing scientifically.
That is so amazing. So I had heard that some people were testing positive for the virus, then they were getting retested to when they were feeling better, they would test negative, and then they would follow up and test positive again. Have you heard that?
Of course, yeah, I have, because that was my fear. And that's what really, I really want to find out about the antibodies, which I have to, again, on a sidebar say, it's not our get out of jail free card. Anyone out there that tests positive for antibodies, we don't know if you can get reinfected. We don't know if I could relapse. There's still not enough known. So having that, I know that technically I feel like, oh, I can go back to work, but sure, I still have to have a mask on. I still have to social distance because we don't know enough. But I was worried that I would actually retest positive because, well, I didn't ever, that was my first negative test. So in a few weeks from now, could I test positive again? Well, I would think if I had symptoms, I would get checked. But right now, thankfully, other than a week ago losing smell and taste, so you're talking about a 5-week duration with symptoms, kind of lingering.
Yeah.
So, it's really, it's scary actually.
It is very scary what we don't know and how it feels like it's mutating as it goes. Now, when we spoke before, you and your husband are living there in this home. You are feverish. You've got all the symptoms. You tested positive. He is next to you. He has 0 symptoms and tested positive. And you were sort of wondering whether it could go back and forth between you. Like maybe you are reinfecting him. He gets it. You're feeling better. He reinfects you. Is there any more of a conversation about that?
So I asked this doctor out here, Dr. Lawrence Shearer, who was overseeing these, the testing site. And I asked him that question because he's been doing this for 30 years. He's an immunologist. He actually knows Dr. Fauci. So I thought, this man could probably provide me with this answer. He just said to me, he said, I can't answer that. We don't know enough. And
Mm.
he said, it's only 4 months, in going forward, we're going to know a lot more. But because I said, is this like almost like a bad case of lice in someone's house that you're not, because he didn't have symptoms. Like, when did he get infected? And all of that. So, but he couldn't answer that clearly. And I've asked my own doctor. He wasn't my doctor. He was providing the tests to the community. So he couldn't answer that.
I have one more question, then Corey, you can ask a question. Is this serology test easy to get out there? Because I haven't heard that it's available around here.
To get antibody testing?
Yeah.
So, all right. So as regarding the antibody testing that's out there are four, what I was told, so I'm not a doctor, I'm not in the medical profession, but according to Dr. Scher, and I did some research, there are right now 4 antibody tests that are technically approved by the FDA. The test I took, and this is not, it is available to answer your question, but not for free. The county is not providing free testing. Our county here in LA is providing a lot of free testing for the nasal swabs and that to get tested for the virus. But for antibody testing, it is available. You can access it privately through doctors. So there's about 200, I think, of these antibody tests circulating in the country that have what he told me were EUA approved. So they're actually emergency use approval through the FDA, technically. Does that make sense?
Yeah.
So it's like, and you have to meet criteria to get that authorization, I understand.
Mm-hmm.
So the test that I took, for example, you just have to call up and make an appointment. You don't have to have I have Mass insurance. I'm based in Mass. That's not required. So anybody can do this drive-through test right now, whether you even think you were exposed. You just have to be able to pay a little bit out of pocket. There's some coverage with insurance for certain things, but so I was able to pay for the test.
Okay.
That answers your question. So it's access for those probably can afford $50
Right.
is what I pay out of pocket to get. But the test that I take, it looks like an EPT pregnancy test. It's like a little plastic cartridge. It's like point of contact. They took blood from me. It took all of a prick of a finger, dropped it in the little cartridge, and you wait for the pink line to show up. And that will tell you, yes, you have antibodies, or no, you don't. Yes, you have a live virus. No, you don't. So that's the test. And it was called, if you want to know, you can look it up, called the Corona Check. I have my info right here.
All right.
Corona Check.
Okay. CHEK.
Yeah.
Okay.
So and this was the results and they're looking at, I guess, they're looking at proteins in the blood. It's like called IgM and IgG, what they're testing for. And I asked him, like, what should you ask your doctor if you want to get a test? He said, this is what's key. You need to find out is if the testing that they're providing has cross reactivity. So in other words, how did I know I was just getting tested for coronavirus only? It's actually called SARS-CoV-2. What is it reading for? Could it show me that I had the flu? Well, his test, he said, is only detecting for SARS-CoV-2, which is COVID-19, but there's also a percentage that it will detect other coronaviruses.
Right, I've heard that.
But he said, I never got sick with SARS or the other coronaviruses, but it will not show influenza A. So it does only test for coronavirus. That makes sense?
Yeah, that does make sense, because there are other coronaviruses, but you haven't had them, so and you clearly have had COVID-19. Yeah. Corey.
Liz, when you do get a positive read, what are the doctors recommending you do? Are you prescribed anything? Is it just rest? Like, what happens then?
Are you talking about if I'm getting positive to be currently with a live virus?
Yeah, is there any sort of treatment that happens once you're identified as a COVID patient, that you have the virus?
So when you're identified as a COVID-19 patient with a live virus, usually you have symptoms and they're just going to recommend to go home and to do that kind of treatment. In fact, when I asked the doctor, he said the only recommended treatment for him in his mind is social distancing. That's in a strange way. He said that's the treatment. So, you just have to continue. If you're currently sick, you want to be self-quarantined. But when you have the antibodies, again, he couldn't recommend that I could be out in public and not worry about infecting people because there's just so much not known about what does it mean to have the antibodies. Right. And so I actually said to my husband, why are we even getting what does this mean for us? Is it just a psychological? But he also said with most viruses, if you have antibodies, it pretty much should mean that you can fight it if you're exposed again. If it acts like every other virus, then yes, I should be protected, right? But because this isn't like every other virus, okay? It just spread in 6 weeks around the world. So those kinds of things. There's just too much they can't say yet, I think.
And it seems to me that it's so interesting that your husband he tested positive, but he did not get sick and he does not have the antibodies. So does your body need to be fighting this thing off in order to get the antibodies?
I asked the nurse practitioner that question when I saw his result, because I was hoping he had the antibodies too. I mean, the fact that he didn't have to go through the painful symptoms I did, he let that pass. But at least it'd be nice to know there's a family unit. Maybe we have this extra protection going on. She said there are absolutely people that are going through the test site, no symptoms, have the antibodies. So you can be asymptomatic and have antibodies.
Antibodies. Now, getting back to the testing one more time, maybe you said this, but do you need to prove, can I go in there because I think maybe I had a sore throat and a headache 3 weeks ago and get tested for antibodies? I can?
How these are working is they don't even ask you if you think you have had a prior exposure, if you've been tested positive, because what's happening is people are calling his office that in January, for example, my cousin on the East Coast said, for 4 days, I had a high fever. He lives in New York, had a high fever, and I lost smell and taste. I probably had this thing. And in California, I think the first known death was like the beginning of January, that they actually were able to connect it. So I'm telling you this because yes, you may have had it already. So you should get checked. You and Corey are really active in the community. You're out there running around. So if I were you two, I would see, what's that?
Heather's a shut-in. I'm the active one. Heather's a shut-in.
Exactly. I know you're not running around now, but it would be nice for you to know that you might have the antibodies. So yes, you can be tested. They don't ask you. I mean, if they didn't, they wanted to know. Of course, they ask. They will, but it's not necessary. It's not a requirement or criteria. They just want to see how many people have been exposed to it. At least you'll know that from the antibody check.
Right.
More information.
Yeah, definitely. And I know that Massachusetts is really upping its testing game. So maybe we will have more access to these.
So are you saying right now in Cape Ann, for anybody out there, the residents that want to get an antibody test, they just go right through their doctor's office at least? Or how is that happening? I'm curious.
I don't know anyone who has had the antibody test.
Yeah, me neither.
Yeah. I haven't heard that it's available. So, so maybe it's not here. We'll have to find out. Yeah. I mean, my husband has no access to the antibody test.
Well, I will email you the information on this particular company, and maybe, you can connect with Dr. Shear out here. This whole pandemic has no borders or boundaries. So what's happening in California should be happening there.
Right.
I mean, I think both states are working hard to flatten the curve with the social distancing rules, which, our governor here in California has just tried to clamp down on everybody going to the beaches. I don't know if that made national news out there.
I saw that, yeah.
Sure, everybody there's being mindful. I know people aren't going to Singing Beach or Good Harbor still, right? Those are all closed down.
Yes.
Well, there are people still walking, but it's not like the parking lots are completely closed. You can go and walk there, but yeah, there are hardly any people out there.
Yeah, I know I'm getting off subject for what's going on, but the whole thing is just amazing what this is, everybody's lives, right?
It really is. It really is. And to watch the summer open up or not is the big trial right now, as you well know. And Gloucester's just opened up its public boat ramps. So that is something everyone will be looking at this weekend because it's supposed to be a sunny day on Saturday, and we'll see how that works out.
Yeah, no, you just have to see. I mean, if we're flattening the curve, is it because we've been done a great job as a community and a world to try to social distance? Everybody's getting antsy, and
Right.
you kind of have to. I had this conversation with a Chamber of Commerce head here. It says, we see that we're saving lives through social distancing, but what about livelihoods and how everyone's lives are upside down? Like, can you balance that? And again, the doctor that did my test said that's an impossible question to answer.
Right.
I don't know, so.
I think so too. Well, so what's next for you and your husband?
Well, we're still out walking around and trying to get out daily and exercising and taking care of ourselves. And we still pretty much staying safer at home, as we call it, until we hear more. Our community in RPV, where I'm living now, it's going to probably be, I think, May 17th, we'll know more. So to answer your question, I think, maybe we'll be able to get out more. As soon as things open up, though, we're back on Cape Ann, I'm going to jump on the first flight I can and head to Manchester by the Sea, which I miss so much. But we're just doing puzzles And how about, yeah, you're the one that you've really stayed home, right? You're staying in, Heather.
Yes, I have not gone anywhere. I go for my run in the morning, I go for a walk in the afternoon, and I am really happy. But I talk to people like you all day. It's really nice, actually.
How about you, Corey? Let's hear I want to hear what your play dates are like.
I'm out and about. I mean, I had new bridge members today join over in Rocky Neck, so I was shooting a video there, and it was weird because there are 4 owners, so we have them on separate sides of the building. I'm keeping social distancing. They have masks on for some part, off for others. Like, so it's weird, but like business has to go on. Like life has to go on at some point here.
Right. And
You know?
since if there's still time for women on that subject, because as we all, I've been a reporter for a long time, as we go out and part of what we do is we have a microphone where and I've done television for 30 years as a reporter. I don't think I've ever wiped a mic off. I've never thought of it like that. I mean, do you guys do you wipe, honestly, do you wipe? Now we'll be spraying.
Yeah.
You don't really think of that. Like if I think you cover, the St. Peter's Festival and you're like, what do you think? What do you think? I mean,
that won't happen anymore.
And actually at the party, that controversial party I was at, when I got exposed, supposedly got exposed, almost everybody that was on the microphone I was at a birthday party, as you know, that almost everybody that was on that mic did test positive for the virus.
That's amazing.
So who knows? So, but back to your work. So like when I did the interview with Dr. Scherer that gave me the test, he stood 6 feet away. I had the microphone in a bag. I had Purell wipes. Like, so what are you doing to do?
The microphone I use plugs into my phone because that's what I use. But I have a pair of like baby socks balled over. It is a windscreen and a protector, and then I just throw those on the wash.
Okay.
Yeah.
So you've got it figured out.
Better than a windscreen. Yeah.
Yeah, I did go on Amazon and it said microphone sanitizer, but I'm sure
really?
it's the same as using any other kind of sanitizer, right?
Yeah.
Yeah.
What were you going to say, something, Heather?
Yeah, I wanted to ask about all those other people who did test positive from the birthday party. How are they doing? Do you know?
So of the group, and that was all, we all feel we were exposed at that time because everyone got sick 3 or 4 days after. Thank you for asking that. There was about 20 of the 60 plus people there, I think it was, that all had symptoms, and we had the one man that passed. But since then, that's still, fortunately, there's nobody else that it became, that they died. But for the most part, everyone's recovered. Right. And everybody's sort of gone on their own way. And honestly, I think all these people I was communicating with regularly to track the virus when we were sick back in March, it's like we need that mental pause from it. Right. It's almost too much. Like I didn't realize how much emotionally it was impacting my world. Like it's heavy because while you're exposed to it and you're feeling what you actually do think, is this going to take me out? Absolutely. It's like, no, it really feels like that.
Yeah, no, it's really, as you learned from my husband's interview, we had that brief moment when suddenly you have to think, wait a minute, this could be very serious. So being actually symptomatic I can't imagine going through that.
So you two go out in the community, not yet, quite yet, to be able to interview folks on the street 6 feet away. None of that's really taking place.
No. We're not even going back to the studio for months. Well, it's just learning the new remote world that we're all living in now. That's it, and just adjusting to it.
Right. Well, fortunately, we can communicate virtually at least. It's connecting people actually, interestingly, in a whole new way.
Right.
It's a bad thing.
Yeah. No, it's I think it's a pretty interesting medium, and it's pretty facile. I mean, it's not quite the same as seeing people live, but it's facile. It's fluid. I think it's pretty interesting. So how it goes. So.
Well, I appreciate all you're doing and covering so much in the community. I am blown away by all what you two are doing with everybody, lining up all these interviews. And
we're taking a little break next week, and we're interviewing a national television chef. So
wow,
pay attention to that one. Yeah,
look forward to seeing that.
Yeah.
And enjoy your upcoming weekend. And thanks for tapping into my world.
Well, it's great to see you. You look beautiful. You look super healthy and great. So that's nice.
I just have to get a haircut. That's not a big issue at all. It's not even an issue, but my husband's like, cut. He wants me to cut his hair. I said, oh, maybe I'll try.
Yeah. Well, those are low priorities actually.
Exactly. It doesn't even really matter, but
you look great. So
you can't look as adorable as Corey.
Right? Exactly.
You can't fight science. I think that's one thing we've learned in the last couple of months. You can't fight science.
Right. Well, enjoy your weekend, and we'll just keep checking in. And I'll let you know when I get that plane ticket.
Yeah.
Yeah. And then we'll still do remote interviews, but we'll know you're closer.
Yeah. Well, I'll still be doing my Scoop Manchester with Erica, and I know you have her on all the time.
Yeah, that'll be fun.
Even getting this skinny.
That's right. See?
I love that.
You know that I'm watching. As I say, I love it. I love it. It takes a village. We got to keep sharing information and work together, which is nice.
You guys are great together. Yeah, it's a nice show.
All right.
All right.
Boy, happy weekend.
Stay healthy, Liz. Good seeing you.
Be safe.
Bye-bye.
Thank you.